Hello viewers, today we're going to talk about complications of hepatitis. As we already defined what hepatitis is, we said it's inflammation of the liver. Now, the normal liver, we define it as very spongy liver. And to really appreciate what we mean by it being spongy, is taking a fresh foam and soaking it in water. When you try to press it, the feeling you get, that is what we mean by it being spongy. Now, one of the complications that may arise, and the complication is as a result of recurrent injury or insult to the liver. For instance, we talked about the effects of the viruses, we talked about alcohol, we talked about fatty liver, we talked about some genetic conditions like hemochromatosis, Wilson's disease, and then autoimmune hepatitis, amongst others. All these will incite an inflammation reaction in the liver. It's like an injury. So how does the liver respond? When all these things are going on and the liver is trying to respond, it leads to scarring of the liver. And the scarring of the liver is what we call cirrhosis of the liver. So, when you lie on a foam, a fresh foam, it appears very spongy and nice, but if you lay on it for a very long time, with time it becomes flattened. So that is typically how liver cirrhosis appears. Normal liver spongy, and then cirrhosis is scarred, is smaller, is shrunken. Now, one of the main complications, as we said, is cirrhosis. And then sometimes the patient may also develop what we call portal hypertension. What do I mean by this big word? Now, when the reason why the liver is spongy is that it has a lot of spaces in between, and that's where the blood is flowing. Now, when the scarring occurs, all these spaces will shrink. So when the blood is coming, the blood usually from the lower part of the body, from the upper part of the body, all will go through the liver for it to be filtered before circulating into the whole body. Now the blood is arriving in the liver, but there's lots of pressure because all the spaces are blocked. It's like a choked gutter. So what it does is that there's a backlog of this blood, those coming from top. You notice that the veins in the esophagus or the veins in the throat get enlarged, and then the patient may start vomiting blood. The other thing is that those coming from the lower part of the body, because of the blockage, all the tiny vessels open up, and then you have veins, you see veins that are distended on the abdomen as well. And sometimes it also causes the patient to bleed per rectum. So they are there anytime they want to pass through, they are bleeding. There are myriad of causes of bleeding, but portal hypertension, that is what happens. And then what the doctors will notice if you have portal hypertension is that the spleen, which is an organ on the left side of the abdomen, gets big. Okay, so the ultrasound scan may pick it up, and then there are ways of managing it. We have the medical management where we give drugs that will reduce the pressure within the liver. And then sometimes if the patient has vomited blood, the dilated vessels in the throat are also worked on. The next complication is what we call ascites. So you see that the abdomen gets very big, and then the legs are swollen. It's as a result of fluid retention. And this fluid retention occurs because one of the main functions of the liver is to produce a very important protein we call albumin. And once that albumin, what the albumin does is that it keeps all the fluid within the blood vessel. When the liver is not producing this albumin, all the blood or the fluid seeps outside the body, and that's what causes fluid accumulation in the abdomen, and then the legs get swollen. The other complication that may arise is what we call liver failure. That is that the liver has been inflamed so much that it's not able to perform its work well at all. The patient may become jaundiced, may become confused, cannot sleep in the night, usually sleeps during the day. Everything sometimes may even behave in an abnormal way that relatives do not understand. But all these are part of liver failure. And the most feared complication is liver cancer, which we will take in our next lesson.